A little bit of anatomy. So plantar fascia is going to be connective tissue that connects from the calcaneal tuberosity of the heel, and it's going to make its way into these metatarsal heads, the met heads. Now, you have a lot of muscles underneath of that. One specifically going to be a very important muscle called the flexor hallucis brevis. And that's going to connect in this general area around what we call the cuneiforms. And it's going to go follow this big bone right here, that first metatarsal, and it's going to go over these little two bones here, those sesamoids, before connecting to the proximal phalanx of that first toe. So why is this important? Well, it's important because if we don't have that muscle strength that's going to create and support that arch when we toe off, what's going to happen instead is we're actually going to lose that arch, potentially overpronating. And if you want to imagine, if you're overpronating every single time you take a step off, well, those little muscles on the bottom of the foot are essentially being repeatedly overstretched with every step. So the problem with plantar fasciitis is not just, oh, the muscles on the bottom of the foot are too tight, creating extra pull and tension on my heel bone. It can actually be that plantar fascia is being overstretched, and over time, there's just excessive wear and tear on those attachment points. So you have a lot of local inflammation. You can start to develop that typical morning pain that you'll feel as soon as you step out of bed. And so what do we do to fix this? Well, essentially, rolling on a tennis ball on the bottom of your foot and icing your foot, it's not going to do anything. You're already releasing muscles that are overstretched and potentially inhibited. So we really want to bring back some strength of that foot. We can do that with doing some gait retraining exercises, teaching your body to properly pronate or properly supinate. But the big one really is starting to properly engage those toe flexor muscles. Again, that flexor hallucis brevis, that's going to connect to these cuneiforms over to that proximal phalanx. And then a lot of the other little muscles of the foot, along with our stirrup muscles. So that's where we're going to get into tibialis posterior, flexor digitorum longus, flexor hallucis longus, all really important muscles. So again, you just have to ask yourself, if stretching and icing and sleeping in a boot aren't fixing your problem, well, chances are your body's actually craving some more strength and stability of that foot. So if you have any more questions, give us a follow on Instagram, book an appointment with us, and we can definitely find a treatment that works for you.